first thing I'm going to do is I'm going to identify my patient, whether it's an inpatient or an outpatient, and collect all the required information. So next I'm going to ask the patient if they've eaten or they've fasted. After I ask them that, I'm going to explain the procedure. So I'm going to tell this person, he or she, that we're going to collect some blood specimens for his work. After I do that, I'm going to assemble my equipment, make sure I have everything ready. After I've made sure I've got everything ready, I'm going to go ahead and wash my hands. And I'm going to go ahead and put on my gloves. Okay, after I put on my gloves, I'm going to break the seal of my needle. I'm going to insert it into the tube stopper. Okay. Before I begin, I'm going to tap my tubes to make sure all the medicine in there is dislodged. Okay. Now I'm going to insert the first tube slightly, not all the way. Okay. Next, I'm going to search for a vein. Okay. I'm going to ask the patient to close the hand so I can see the veins. Okay, found one. Next, I'm going to rub that area with some alcohol. After I rub the area, I'm going to let it dry.
Could I borrow one of these?
Okay. Before I do that, I'm going to apply this. Totally forgot.
Sounds right.
Okay. I was supposed to apply a tourniquet, ask the patient to close their hand, look for a vein, and then rub with alcohol. Okay, once I've done that, I'm going to hold the skin taut with bevel up. I'm going to insert into the vein, and then I'm going to let go, and I'm going to push in my tube. Okay, once it's filled up, I'm going to take it out, shake it a couple of times, draw in the next tube, okay, last one. Can we try again? Okay, on the last tube, I'm going to let go of the tourniquet. I'm going to ask the patient to open their hand, and with a piece of gauze, I'm going to remove my needle. I'm going to close. Okay. I'm going to apply pressure for 3 to 5 minutes. Dispose of my needle in the container. Okay. I'm going to recheck for the arm label to make sure this is the correct person. Okay, once I've done that, I'm going to label my tubes. Make sure I put the name, the ID, the date. Okay. For all of them. And the specimen that I collected. Okay, once I've done that, I can go ahead and take off the gauze, dispose of it in the proper container. I'm going to apply a bandage now. Okay, once I've applied my bandage, I am going to dispose of my gloves in the proper container. After I've disposed, I'm going to clean my area. Before I do that, actually, I'm going to clean my area and disinfect. Then I'm going to dispose my gloves, and I'm going to wash my hands. And that's it.